So now I'd like to introduce you to Kathleen Ness. She needs no introduction. She was introduced first thing this morning, and she is my boss, so I do welcome Kathy. She will be talking about our Alberta Immunization Strategy and the update that we'll be providing. So please join me in welcoming Kathy Ness.
Thanks. So I'll just, while we're getting set up here, I want to also thank my colleague. And of course, as you can see, he has absolutely no passion for this topic at all. It's such a pleasure to work with him. So I also have no money, and so therefore declare no conflict of interest. I'd like to spend a little bit of time talking about the overview of the Alberta Immunization Program, some of the drivers for change, and of course, in keeping with our program today, looking at some of the reasons why we looked at a refresh, renew, rejuvenate approach. So our Alberta Immunization Program, just a bit of an overview. So we have the Ministry of Health, Alberta Health Services, and we have a whole group of health system and community partners. And it's important to note that some of the provincial policy level leadership is very much part of what the ministry is providing, but in terms of the operational delivery and level leadership, we have our partners, Alberta Health Services. We run the provincial vaccine depot at the ministry, but there are 16 provincial depots that are scattered throughout the province. And working together in terms of having a provincial database at the ministry, we have a number of systems that feed into that through Alberta Health Services. And we have regional zone surveillance as well as sort of a provincial overall surveillance program. So we have some very interesting pieces in the center here that overlap, and these are not really overlapping. These are really the synergies and the collaborations between the two groups, and these are an important part of what actually gets our work done. Our community health system partners, we have a number of licensed immunizers and a variety of settings that other work goes on. And these are all important components, and we heard the Minister of Health this morning say that these are groups of individuals, and how we collaborate and use the synergies between these groups is what is going to help us get our work done into the future. The Alberta Immunization Strategy was released in 2007, and while we know that immunization has been around for a while, and it is one of the most comprehensive programs, and particularly in Alberta, we like to think it's one of the most comprehensive programs in Canada. Since 1996, there was a fairly good indication that rates were really declining, and particularly even up to between 5 and 20% below target with some of the childhood immunization programs. So the intent was to launch a strategy that would put in play a number I guess a path and a direction. So building on some of the national immunization strategies, looking at partnerships, accessibility, enabling technology, evidence-based, education awareness, performance accountability, all very, very, very good words. But we decided that in 2012, 5 years into this program, we needed to take a look to see if, in fact, we were heading in the right direction and going where we needed to be. In fact, we actually determined that the strategic directions and the principles were still relevant, but there were so many changes. So just a quick historical review, because I think it's relevant not only for our province, but I'm sure that for every single group across the country, there are things that come in the way. So while the report was released in 2007, in 2008, Alberta Health Services was created. So this took it from 9 regions to 1 service provider. Now, that meant mergers, changes, big changes. So in terms of launching a strategy at the same time that you're reforming an entire province became somewhat challenging. There were new vaccines, however, such as the HPV for girls that was introduced, and those were all good things, but this was also in the midst of trying to sort things out. In 2009, just about the time we thought, okay, we're going to get down to doing some actions, the H1N1 pandemic hit, and so we were also rolling out a universal influenza program and bringing on other providers such as pharmacists. So who had time? Who had time to look at other strategies? In 2012, that's when we said, okay, we must take a look at what is happening, and take a look at a midpoint refresh. And in 2014, where we are today, while we're still introducing new vaccines, dealing with outbreaks, we are looking at, and what I'm going to present now is some of what that strategy refresh looks like. One of the things that I think we learned from the beginning, while we had all of those very good components, is that we need to have a bit of a triple aim or focused approach to achieving outcomes. So looking at it from a population perspective, a system perspective, and from a program perspective. So looking at whether or not we have, so from a population-wide perspective, do Albertans understand the value of immunization? Are they engaged? Do we have a high public demand? Is there increased rates and decreased incidence of diseases and improved overall health? So really looking at it from that big macro level. Also, from a sustainable health system approach, is integration integrated with a broader health system? Are there synergies and efficiencies? Do we have less demand on other services as a result of a healthy population, better value for investment? And a big focus right now is looking at results-based budgeting, so based on looking at the results of the budgets that go into the programs. The last is, and not least, of course, is the high-performing program, effective, efficient, timely, safe, and having a variety of focuses. So these all became important components in trying to look at how we were going to adjust our services. I'm not going to focus very much on this slide, just in the interest of time, but to say that the population health drivers, making sure that we knew the new diseases and vaccines. What we did was we pulled together some focus groups, consultations with our service providers and with Alberta Health Services Group, had working groups that were looking at the evidence behind each of these components to say, what are the drivers for change? What are we going to have to know? What are we going to have to change? So it's somewhat tied in with what Martin was saying with the national strategy, looking at the evidence as well. We did, and in your packages you'll see a rates coverage for Alberta, and we thought this important to share because it does help us understand where we've come from, and although this doesn't have previous years, we do have an interactive health data application website that folks can actually look at some of our past immunization rates, and it does help us take a look at where are the areas that are good and where do we need to advance. So having said that, we really have still some ways to go because we are not hitting the targets. The health system drivers for change, same part of the consultation processes that we did across the province, looking at what are the demands to maximize efficiencies, what is the focus on wellness, how are we going to look at the capacity. So we're hearing more and more vaccines coming on stream, fewer workers, or a change in workforce. Do we have the capacity to do what we have to do? Very big focus on primary health care. So what does that mean for public health? What does that mean for immunizers? And how do we build a sustainable system? So I'm going to give you a picture. So the first part of the picture, because I like pictures, if anybody knows who works with me, I like pictures, and it starts to set out the song sheet for so that we're all singing from the same page. So looking again at it from a perspective of both the population health, the health system, and the program, looking at making sure that we have targets that are achievable, that we have better experience for Albertans, that we have increased prevention, decreased disease, better value, and then at the very top, of course, improved overall health outcomes. So it just starts to put together all of what we heard in terms of drivers for change into a picture. There's a second part of the picture, and this is the part I'm going to spend a little bit more time on and make sure that I can just give you what's really just going to be a very high-level picture. So we have our values, and of course all programs have values, our enablers, and more, I guess the piece I'd like to focus on now are some of the areas for action. So we have 4 key priority areas for action: stimulate demand for immunization, engage Albertans, enhance the data and information management, optimize the vaccine supply and management, and integrate and coordinate. So we feel that if we have actual actions for each of these and achievable goals, then we actually will get to the place that we need to be. So I'll just quickly run through these to give you a bit of an idea. As you can imagine, so we released this late fall of 2013, or released in the sense that we felt that we'd taken it as far as a work group could, as far as it could go. The intent is then to focus on putting some action plans behind these achievable goals. Now, having said that, it seems like we keep getting into outbreaks. I don't know. We seem to have other work underway, but we do actually have some very good actions underway, and I'll go through these. So the demand for immunization engage Albertans. Our intent is to ensure that Albertans do trust vaccines and believe they're safe and effective. So we need to find mechanisms to make sure that that is part of the picture. Albertans need to understand the risks of vaccine-preventable diseases. And we've heard from the minister, and I think he's, and the chief and our various service providers have made a concerted effort to ensure that either through ongoing communication, that is part of the message. Albertans value immunization, understand the importance of benefits, and we have a number of tools that Alberta Health Services will be using right in the frontline throes of where folks are mostly taking their children, so they understand what is the schedule, what's the value, and that they can trust and follow the schedules. In order to do this, what we hope is to have some solid actions behind, and we do have, but again, in the interest of time, I won't go through these, but happy to talk about it at the break. Enhanced data and information management. This is one of our key really linchpins to everything that we're going to do, whether it's timely, reliable, standardized, comprehensive information and data that's used to support surveillance and reporting, and making sure that all immunizers are delivering and have point of service access, one immunization record per Albertan. So we have a roadmap, we have an IT roadmap, we have bits and pieces and components of this, but if we're going to engage other providers, if we're going to expand the program, you must be able to know that that one person that you're looking at in front of you, that's the record for them, and that it isn't a mix match of something else. So we do use the data for things, and this is an example of looking at rates and based on making sure that 95% of our population would have good herd immunity, but are there particular pockets, and you can't read this graph from where you are, but it's showing how we are also using the data to make sure that we're looking at things like poverty and who in which quintile are really immunizing. The last is our vaccine supply, making sure we we are changing some of our supply distribution mechanisms and storage, and updating and doing some leaning around this. I see that I have my 0 time, so I'm going to just say the last is to integrate and coordinate. And again, working with our new primary care physicians and groups and pharmacy groups to look at how we ensure we have the information, make sure that we have all of the outcomes that we're hoping to achieve. The enablers, looking at performance measurement and reporting, will be a big one, as it is across the country, change management, system thinking, and really having that leadership and governance. So here it is, all together. And again, it's really the roadmap, and it's the song sheet that we're hoping that people can pick up and say, yes, at the end of the day, every single action, everything that we do is going to lead towards the improved overall health for Albertan population. The next steps, the planning matrix, so looking at it from childhood to influenza, adult, and often where you're chunking these components down, because looking at the current state, future, and then of course the implementation requires a different set of actions, a different set of components. And we're, if you take it's hard to know what one small step is going to mean in terms of how big it could have as part of an outcome. So we're hoping to be able to embrace the little things. So for one day we may look back and realize that it was actually a big change that we initiated. And I guess the focus for our future is around the partnerships and integration. And I recently heard someone say that no matter who you are, where you come from, or what you may or may not achieve, your dreams are always valid. So we have a dream to embrace some of the national strategies, to make them part of our own, and to take this now and work with all of our providers to accomplish what we hope will be the best program in Canada. Thank you.